I wish we had found you earlier. Charlotte was in tutoring. She was struggling to read. We weren't sure what the problem was. We thought at first it was glasses. And it didn't fix anything. And it wasn't until coming here and going through the process that things have changed 100%.
So vision therapy is a systematic treatment that we cover over multiple sessions, training and teaching a patient using tools and communication and knowledge how they can use their eyes more efficiently.
Her confidence that she is not struggling in school, she's thriving. She's a wonderful reader. She loves to read. She was really having a hard time with it.
So about 80% of what you learn in your life comes through your visual sense. Most things to learn we don't need to taste or smell or touch. Most things we learn about comes through our visual sense, 80%. So if your vision is not operating at the best way possible, then you're at a learning disadvantage.
She was not up to the reading level where she needed to be in school. We did speech therapy. We had her working privately with a tutor. We had a reading specialist at school. We tried those three things and nothing was changing. She realized after coming here and going through some of the first tests that she was seeing double, that words on the page were kind of jumping around, and that's not how reading should be.
Most of the patients we see are kids trying to learn how to be great readers. There's also adults who struggle with the way their eyes feel on the computer, athletes who want to have better vision and better visual abilities like depth perception and peripheral vision and eye-hand coordination, or even people who have unequal vision between each eye. They could have one eye that sees really blurry, or they have an eye turn that they're trying to straighten and use both eyes simultaneously.
And as a child, how do you explain to somebody that things might not be right because she didn't know that it was right? That's how she learned, and she didn't know. We didn't know. And as parents, you try to help your child out as much as you can. That's those three things that I mentioned before that she did weren't working. It wasn't until we came here that things really took off. To listen to her read out loud before versus now, I have to say it again, it's just her confidence, it's just there. On the way here, we have a 45-minute drive, and I said, do you have any homework? And she said, just reading, but I'm doing it now. And I looked in the mirror, and sure enough, she's got her half-hour reading in for today, and it's done. And it's not a struggle. And if you're on the fence about it, just ask some questions, and I don't know, I'm so happy, I'm so grateful that my wife looked into this and that we heard about you. I tell my customers, if you hurt your ankle and you have surgery, you go to physical therapy, well, why wouldn't you, if you're not seeing correctly, why wouldn't you try something if glasses aren't working, if surgery didn't work? Try something that's not medication or invasive, and it really does work.